leaders of the world. Welcome to Spread Love in Organizations, a podcast for purpose-driven healthcare leaders striving to make life better around the world by leading their teams with genuine care, servant leadership, and love. I'm Naji, your host for this podcast, joined today by Rosemarie Day, founder and CEO of Day Health Strategies. Rosemarie served as the founding deputy director and chief operating officer of the Health Connector in Massachusetts. At the Health Connector in 2006, she helped lead the launch of health reform in Massachusetts, which became the model for the Affordable Care Act. Prior to this role, she was the chief operating officer of the Massachusetts Medicaid program, among other state leadership positions. She has been working on health reform ever since and is passionate about universal healthcare and women's health issues. She is the founder and CEO of Day Health Strategies, a successful mission-driven women-owned consulting firm that celebrated more than 11-year anniversary now. I think it's 12.
It will be 12 in July. Yeah. Mm-hmm.
Brilliant. She is also a mother, a breast cancer survivor, and an activist. Rosemarie is the author of the book Marching Toward Coverage: How Women Can Lead the Fight for Universal Healthcare. Rosemarie, I am so excited and so humbled to have you with me today.
Thank you, Najee.
First, I would love to hear your personal story. What's in between the lines of your journey?
So the older you get, right, the longer the journey has been. But I think in keeping with your questions as it pertains to being a purpose-driven leader, I really can't think of a time that I didn't feel that there was some need for there to be purpose in my life. Even in high school, I went to a large public high school in California, and I remember I grew up in San Diego, which is a beautiful beach community, and I remember people, going surfing after school and just kind of, relaxing and enjoying themselves. And I always felt like, no, there are too many problems and issues in the world. We really need to be focused on studying and figuring these things out and what can we do. And so I really was applying to college with that in mind, of trying to figure out how I could work to solve, or at least help mitigate a lot of the world's problems. Probably at the time I would have said solve. I'm humbled by reality now, all these decades later. But I was fortunate to be accepted at Stanford University. It had been my dream school. And I discovered the major of public policy when I realized that being an engineer wasn't going to be exactly the focus I wanted in terms of the kind of problems I wanted to solve. So I got to join this fledgling interdisciplinary major. That was a new thing back in the day, to have something interdisciplinary. And I really thrived in that kind of environment because I'm very much a generalist. At heart, I like to try and integrate lots of different types of information and then apply that to solutions. So I was lucky in finding kind of the right place at the right time. And then, went to work in a nonprofit and felt, energized by the work I was doing. It was the YWCA, which was the women's organization founded to empower women and eliminate racism. So I was really, really attracted to the mission. I was discouraged by our lack of scale, and I wanted to make a bigger difference. And so I followed my heart to Cambridge, Massachusetts, and joined the class at the Harvard Kennedy School of Government. And my idea was to learn from hopefully the best and the brightest about what had been tried in this country, this wealthy country of ours here in the United States, that had maybe worked or could be refined, and what hadn't worked. I wanted to understand really how to solve poverty. And so I was able to come here to the East Coast and study with some of the real thought leaders at the time. And I got my master's in public policy, and from there launched into my career in government. And that was really my goal, was to get to government thinking, okay, that's really where the scale is. And that's where I can make a big difference. what I learned, again, humbling was, well, yeah, and there are a lot of people in government and there are a lot of demands. And if you want to try and change something, it's like trying to, turn the battleship. It is so, a small nonprofit, you can make a big difference just as one person, but you're in at the smaller scale. And then there's kind of the converse with going into government. Um, but I learned an incredible amount. I worked with some really talented leaders here in Massachusetts. People actually like the potential of what government can do. That's not true necessarily across the rest of the United States, but Massachusetts truly is one of those laboratories of democracy. And so I was privileged to be able to help be a part of a number of different reform initiatives, starting with welfare reform and then ending up with healthcare reform. And I did get a chance with healthcare reform, I think, to help move the needle for sure. So I persisted, and that's one of my themes when I give talks about leadership, about taking the longer view and sticking with it. And so I was able to be in government, kind of at the right place at the right time when there was an opportunity to truly test a new idea, and that was the Massachusetts version of health reform. Which then became, as you said, the model for the Affordable Care Act for the United States.
So you did impact and help so many patients. So it goes back to your purpose, as you said, you're purpose driven. So looking back, you've done this. I'm curious, you talked about leadership, and I love what you said, take longer view and stick with it. I'm curious, from this lens, any other trait, capabilities you really relied on that helped you make you be successful in such a tough task? It's not easy to lead reforms, healthcare reforms even more. What do you think you relied on as a leader that made you successful to lead this?
Two things come to mind. So it does go back to that sense of purpose, because you've got to keep drawing from some kind of inner core energy, because you do face so many obstacles and times of discouragement, and you have to keep going back to like this core motivation, because it's just too easy to give up and say, maybe I'll try something else. And so, but if you keep reconnecting with that sense of purpose, then that can spur you on even through the tough times. The second thing I'd say is truly collaboration. There is, I'm on one hand hesitant to say, oh, I led reform, because I really co-led with all kinds of amazing people, those who envisioned the reform in the first place and saw it through getting the law passed. And then I came in as a chief implementer of the law. And it took all of, and I was a chief implementer with a team. We built a team, and there's no single one of us who could have done it. Same thing with getting the law passed. And that's a huge lesson, is how is it that you work collaboratively? So tying to your purpose and working collaboratively. And that takes, a lot of ability. Massachusetts has a lot of real smart folks. I would say I've worked with so many high IQ folks. You also need the high EQ. So that emotional intelligence is incredibly important, because it does truly take that village to make something happen. And not everybody's just going to walk in the door and get along beautifully, on day one. Even if you share a common sense of purpose, there are a lot of things, egos and such, that can get in the way, and you've got to keep moving through that. And so I found that I was effective at really working to bring out the strengths of a team and then try to mitigate the weaknesses.
I love that. Can you talk a little bit more about this EQ aspect? And you talked about like leading and managing, or even collaborating and coordinating, high IQ people with low EQ. Sometimes I imagine egos and a lot of other aspects that you need to to manage. There's also the passion, the emotion around some certain views of politics. So how did you? Do you have any tips for us? Well, not necessarily in government, but anywhere, right? Startups, corporate world.
Yeah, I mean, I've learned, because I left government 12 years ago, and I've been consulting all around the country and with private sector organizations, nonprofits, government entities of all sizes. And There are people and egos that's true anywhere. And large organizations develop bureaucracy that you've got to navigate through, whether it's government or private sector. So there are a lot of common elements I've seen in my days here as a consultant, when I founded and since then Day Health Strategies. So I think it's an interesting, like I was going to say, you need to have a healthy dose of patience, but it has to be balanced with some amount of impatience. Because if you're too patient, then you're not going to actually get something done, because you'll just kind of sit back and be like, well, tomorrow's fine. And so you have to kind of keep a sense of urgency, but be patient with the aspects of human beings and human nature that makes it such that they're not necessarily going to see your idea or somebody else's great idea and be like on day one, yeah, I'm on board with that. I've learned an awful lot about change management and, human psychology and, early adopters versus late adopters and all the folks in the middle, and how to work through all of those kinds of elements to a human endeavor. And so yes, there are days I think you've got to have some patience, but you still got to keep it moving. So I guess it's like finding that right balance of the patience and the impatience.
Yeah, I love that. I always share with my team, I diagnosed myself with impatientitis. So, and it's chronic, right? But sometimes it's acute. So I love like this balance of how you balance patience with the sense of urgency.
And, finding that patience, I think I've been working on that, with each passing year, and just trying to, learn and grow myself and learn how to find, I'm not a good meditator, but I know that there's this notion of getting to a Zen place. And I actually find that for me, like through exercise, walking or jogging or dancing or things like that, that through that kind of active movement, but in a way there is a meditative element of it as you kind of get into a rhythm, that really helps me to clear my head, take those deep breaths, and regain some sense of patience / also reconnecting with my purpose. So sometimes you have to, I'm really become a big fan of getting away from the work in order to do the work better.
Oh, that's a great advice. If I double click on this impatience, as I'm hearing you say it, especially when you know that what you will be doing, if you move fast, it will help people, and you're passionate about obviously universal healthcare. You worked on those issues. We know the impact that they can have. So how to balance your impatience when you're so passionate about something and you literally see the impact that it can have positively on people, but then it's still not happening?
That is a good question, and that it is hard to answer. I will tell you, on some days, I'm not that patient and I get incredibly frustrated, and, you just want to like scream or something. And that's when, you've got to like do that self-management, self-care, whatever it is, get moving, get fresh air, go out into nature, find that to just kind of calm down and regain some perspective. I always try to, I've also learned that reading about other leaders who've tackled really tough challenges and had plenty of losses, every leader does, how they persevered through it, and what were their sources of inspiration and how they persisted is very, very inspiring. And so, and that can be in any endeavor, not just like, healthcare reform. So that helps me try to gain perspective and take the longer view with the folks. And so I look at people like Gloria Steinem, who has been an incredible leader of the feminist movement, or Angela Davis. Those are two of my, I should say, sheroes, who are now in their late 70s, 80s, and have seen progress made and have seen major setbacks, and then have seen progress made again. And I really like to hear from them as to how they have managed to keep that eye on, the horizon of where it is you want to go. And they look for, even when we're feeling like we have a major national setback, as I think we're about to experience with Roe v. Wade being overturned, can you find glimmers of where we've actually built up more strength for the cause that we believe in. And maybe that means you're going to the local level, or you're looking at the young people and the awakening there. And you draw, I think, inspiration from that. And so I can't say there won't be frustrating days, because there sure are, but it's, as Martin Luther King said, about the arc of the moral universe bends towards justice. Trying to keep that in mind. But as I say in my book, of course, it won't bend toward justice by itself. So we have to keep being part of the forces, the drops of water, if you will, that will keep bending it toward justice.
Totally. And it touches this resilience, right? Like, and finding this hope as a leader to keep on fighting for those causes. You believe that healthcare is a basic human right. I certainly do too. I would love your idea about universal healthcare and why you believe this is the solution to get into basic human right, that is healthcare. And like, just to give you a color of this, so I'm French, Lebanese, so I like lived different systems, and now in the US for practically 3 years, living also another system, and it's really a genuine question. Do you think universal healthcare is the solution to get this basic human right, which is health?
Yes. Yes. It is necessary. It's not sufficient, because even guaranteeing people a right to healthcare coverage doesn't necessarily mean that all access opens up. And we've seen that in other countries that have successfully gotten to, 100% of their citizenry at least having a basic level of healthcare coverage. And that's true in, all of Europe, and they've done it in different ways, as you know. But it doesn't mean that every single thing is covered. But every person is covered at least at a safety net level. So there's kind of a starting point. And then I think countries have tried to build and add things, as we actually have in America. When we first passed Medicaid and Medicare, for the low income people and the elderly back in the 1960s, it didn't cover back then as much as those programs cover today. We've built on those incrementally as healthcare itself has advanced, and we understand more about drugs and treatment therapies and better ways to provide health. The coverage models have changed. And so there's always going to be some kind of an evolution, but you've got to cover everyone at least at a basic level. And I talk about we have a patchwork quilt of coverage in our country. And I say we've got to have, with holes in it, we need at least one consistent fleece blanket of a uniform level, and then build from there. And of course, there are going to be some people who can buy their way into the eider down comforter level, because that's how America works. And we do have very wealthy people, and they will have those options, but everyone should have at least the fleece blanket. And so, because you basically you can't actualize as a person, as a citizen of our democracy, or even as an economic, participant in our system of capitalism, flawed as it is. Neither of those are possible if you don't actually have your health. I mean, the health part is fundamental to actually exercising your other rights as a person and as a citizen in this country. So when I started college and became a public policy major, I focused at the time on education policy. I thought that was the starting point. We've got to get everybody, to at least some base level education. And then I learned about all the stuff that's happening to kids from 0 to 5 before they've even gotten into school. And how damaging the lack of access to healthcare or adequate food and nutrition and all of those things already set you back before you even gotten into the education system. So I decided I needed to work on poverty because that was more the fundamental starting point. But I also saw that related to that was the healthcare that we can provide. And healthcare, through the formal system isn't the only path to health. It's necessary, though. It's not sufficient, but it's necessary.
So your thoughts on
And let me just add, speaking of kids, it should be a no-brainer in this country, in the US, that every child, the second they are born, should have some basic level of coverage. I call for that in the book, that there should just be an automatic enrollment into a basic level of healthcare, all kids. That shouldn't even have to be discussed or debated.
And it's not today?
No, it is not. There are some special programs for children, but parents have to know about them and go and enroll them. And for lower income parents, people with limited English, all of the folks who have some disadvantages, it is not necessarily obvious how to enroll your kid in healthcare. And there can be, depending on the state, they can throw up a lot of barriers to the access.
And you talked about education and saying that coverage is not obviously sufficient. What about education and health? Like I'm constantly, and in all countries, even countries like France where you have coverage, still you have a lot of problems with people taking care of their health. Mm-hmm. And I'm feeling more and more, I'm thinking of it, and COVID showed again those problems. Definitely there's inequities, there's social determinants, and there's a big lack of, not lack, I would say misinformation, actually, more than a lack of information. Where do you put this in a universal healthcare coverage, like the access to information or fighting misinformation in healthcare? What do you think about this?
Well, a lot of misinformation happens through social media, and that's a whole other topic that, you know, deserves its own probably podcast on that and how to counteract that. But I think linking people into a primary care setting, and I work with a lot of community health centers where you can have that doctor and or nurse practitioner who you can see consistently, who can be a trusted advisor and navigator through the thicket of healthcare issues, and who will be proactively engaging with the community to do the vaccine rollout, to leave their offices and go out with a mobile van and do the things to reach people who haven't yet come in. But once they do come in, to be sure that that coverage is paid for and that people can then latch onto a consistent source of care, because that's where the real information, the right information can be given out, human to human. And community health centers really understand their populations, and so many of the people who work in them are just doing, going above and beyond to connect with their patient population. So I think that making sure that community health centers are funded, and that whether it's the Medicaid program or whichever insurance coverage gets people access to those venues, that's fundamental, and to countering some of the misinformation, getting the right information out there. But that trust, like building trust with a provider. Okay, doctor, I'm worried about my kid, and then they can, family practitioners can look at the whole family too and say, well, I'm worried about you, mom, because of this, and advise on whatever is needed for health. I really dislike how in America culturally we're very prone to blaming the victim and sort of saying, well, if you took better care of yourself, or if you just got a job, or you just did this, then you'd be fine. Yes, I mean, I'm a big fan of like trying to take care of yourself and such, but I also have the means to do it. I'm not trying to work 3 jobs back to back. There are things that work in my favor if I want to try and go for that walk or what have you. So I really, I just think it's unfair that we'll say, well, people aren't taking good enough care of themselves when maybe they don't have access to primary care and a doctor who would be giving them good advice about how they can do some self-help in their treatment. But if you don't even have that, I think it's tough. I think it's really tough. And I'm an advocate of a more systemic solution. It doesn't mean I don't think individuals have their own responsibility. They do, but it shouldn't only be on the individuals. Particularly
and as leaders.
Yeah.
Right. And as leaders, are we building the right systems right? And the fair systems for people to be able to take care of themselves. I think this is kind of one of those pieces before saying, I am not taking care of myself as an individual. Do
Right.
I know how to take care of myself? Is the system helping me out to understand how to do it? I think this
Correct.
is
But
kind of one of those pieces.
do I have access to the screenings? I'm a breast cancer survivor because I had access to early detection. So mine was detected early stage 1. If you're not regularly plugged into the healthcare system, you may not discover your cancer till you're at stage 3 or 4, at which point your odds of living go way, way down, as you well know. I talked to many of my clinicians about these sad stories where, they'll do anything they can to save a life, but if they could have been higher, earlier upstream in that prevention cycle, or catching it early, it makes all the difference. And that has a lot to do with healthcare coverage. I also, just to talk about cultural messages, I told you how I worked on welfare reform back in my early days in state government. And that's when the cultural mantra was get a job, don't just sit on welfare and be lazy. I'm paraphrasing, but that was the gist. And the thing about it was that when people got jobs, they lost their health insurance because at that time, if you were low income, Medicaid only covered people who were on welfare, basically. And the second you got off welfare and you got into a job, well, the typical job, if you were going to be like a house cleaner or a restaurant worker or any of those, did not come with any kind of health insurance. And so you're telling people to go do this thing at the same time you're cutting off their access to taking care of their health, but you want them to be a strong, empowered worker. To me, it made no sense. And that's why I leapt at the opportunity to do health reform in Massachusetts back in 2006, because it was the first program we had that started to bridge that gap. And it wasn't just you only get healthcare if you have a high paid job or you're on welfare. There needed to be a solution for all of the people in this country working hard, but they're working in places that can't afford or won't afford, depends on the place, the healthcare coverage.
Another key lens or angle you have on your in your book, and I believe so much in it. I really believe we would be in a better place if we have more women in leadership and leading the world. Can you share with us your perspective on specifically the title of your book, How Women Can Lead the Fight for Universal Healthcare?
So people talk a lot these days about lived experience and the fact that women still in this country disproportionately carry the load of caregiving. Even with all the successes of the feminist movement and more choices that women have, and certainly women of means have, there's still a sorting process and societal expectations and a lot of things where women end up taking the primary role in caregiving, even in double income 2 career couples. Women are making 80% of the healthcare decisions in the family. That's a statistic I lead with in the book. So that's great. You could say, well, then they're the chief medical officer. But the point I make is that, yeah, chief medical officer in one family is not actually that powerful of a role vis-a-vis the whole society. It's not like a corporate chief medical officer, or being the Surgeon General of the United States. So how is it that you can take that lived experience and turn that into something powerful? And you've got to add everybody's lived experience up and use that. And that's where I talk about the power of collective action, not just to feel less lonely in your own kind of caregiving dilemmas, but then to actually put pressure on the political system and say that the way in which we're making our choices about how tax dollars are being used needs to shift so that we can have more of, my view, a humanitarian kind of safety net, so that it's not just on each individual family to figure that out, because it's too much for most families. Healthcare is far too expensive if you don't get it through your job. And don't have prospects of that. And even those who get it through their job look at the pandemic, there was a lot of job loss. Well, thank goodness we had the Affordable Care Act already well established, because people who lost their jobs had a place they could turn. they could go to the exchanges and get health coverage. That's not something an individual family could have solved with their out-of-pocket spending. So we had set a safety net up that has actually worked and served its purpose. We just need to expand upon it. So yes, I look at women as being that voice for change. And I'm cognizant of the fact they already have a lot on their plate. And certainly with the pandemic, only even more so. My gosh, with the homeschooling and all the things that were added on, it was just almost too much. But coming out of that and being able then, I think, to collectively gather, it's I did the Women's March in Washington. I've done all the women's marches. It is so empowering and uplifting to be with people, like to feel true, get off of Zoom and into human connection and feel that sense of power and potential that we have if we put our voices together and say that we want to rebalance the priorities in this country.
I will give you now one word, and I would love to get your reaction to it.
Surprise part, right?
Yes. So the first word is leadership.
Leadership. So I can just say anything about it, or you want one word back?
First reaction, a word or a sentence.
Incredibly important. It's viewed too one-dimensionally, I think, in this country. There's like a hero leadership model, the guy riding in on the white horse. And there's a lot of problems with that. First of all, that it's only a guy and it's only one person. And so I think we have to have much more of an evolving view of leadership and getting to like my theme of being collaborative and really having it be more reflective of our true society, which means gender balance and racial balance.
Love that. Feminist.
I picture like the woman with the muscle, like we can do it. World War II posters, there was the Rosie the Riveter. That's sort of my like iconic image of feminist. But I mentioned Gloria Steinem and Angela Davis, then that they're right there as like the real people or Ruth Bader Ginsburg, may she rest in peace.
Health equity.
Equity is like the dream. Health equity is one dimension of it. And I guess I'm a bit at a loss because I feel like it's being so compromised right now with our national politics. But I have hope when I look at Massachusetts is just a bunch of leaders, Black and brown leaders have created a health equity compact and are saying this is the next stage of health reform. And I'm really excited to see where they take that and where the rest of us as allies can support that work.
Spread love in organizations.
Love is fundamental to our collective well-being. I think we've seen with the pandemic that, no person is an island when you look at the way disease spreads, which plenty of public health and epidemiologists already knew that all too well. Hopefully that more people understand that fundamentally, that our lives depend so much on each other. And so I wish we could be more connected by love, and that would be carried out in organizations as one of the kind of ways in which to amplify, love between individuals, but make that bigger, make that the ethic. That's a very hopeful statement, and we need more leaders to think that way and get us there. And that may mean that you can't make the biggest profit. So that would be another whole podcast, but that may mean thinking about reasonable returns, reasonable profits. But if you put love higher in the scale of how you measure results, then I think some things would shift from the bottom line perspective, but we would all be much better off as a result.
I certainly genuinely believe in it, and it's part of what we're trying to do here. Thank you so much, Rosemary. Any final word of wisdom for healthcare leaders in the US, but also across the globe?
Um, I back when we were launching health reform in Massachusetts, which we did, you can look back and say, well, that was successful, but it was imperfect. There were so many things we learned along the way, day by day by day. We made mistakes, and then we would try to learn from them and recover from them. And I believe it was Peter Singay at MIT who talked about learning organizations and being a learning organization. And that was something that that I learned about from somebody when I was at the Health Connector. And we started to adopt that kind of as our mantra, so that people wouldn't be, on our team wouldn't be afraid to try things, because we were doing things no one had really done before in the public sector. And we didn't know if it would all work out. But we didn't want people to be afraid to try. And so we would talk to our board about, here's our presentation, here's what we're going to do, over the next 3 months. And then if something didn't work out, we would say, and here's what we've learned, and here's what we're going to adjust and do next. And we are a learning organization. We would use that as kind of our mantra internally and externally. And it gave us more breathing room. There was a lot of pressure on us to succeed and to do it quickly. And that was stressful many times. But I found that was a really great way of helping our team to stress a little less and to give us some breathing room, with everybody who was overseeing what we were doing.
Thank you so much, Rosemarie, for being with me today and for those incredible insights and words of wisdom. Thank you.
Thank you. It was my pleasure.
Thank you all for listening to Spread Love in Organizations podcast. Drop us a review on your preferred podcast platform. Connect with us on SpreadLoveIO.com or on LinkedIn. Most importantly, spread love in your organizations and spread the word around you to inspire others and amplify this movement our world so desperately needs.